This is Michelle from Physioactive Indonesia, bringing to you our Malaysia Surgeon Insights series. Today, we will be discussing one of the most exciting and rapidly advancing fields in modern medicine: robotic surgery. From smaller incisions and faster recovery times to improved precision and control, robotic assisted procedures are changing the way surgeries are performed around the world. But how exactly does it work, and what are the real benefits and the limits? To help us understand this cutting edge technology, we are joined by Prof. Dr. Suhail Suresh, orthopedic and trauma surgeon and anthroplasty from Sunway Medical Centre and Sunway University, Malaysia. How are you, doctor?
Hi, Michelle. Good evening. I'm good, thank you. How are you?
We're good, thank you. Thanks for taking the time to be with us today.
Welcome.
Doctor, let's start with a brief introduction. Please tell us about your qualifications and experiences.
My name is Dr. Suhail. I'm a consultant orthopedic and arthroplasty surgeon, which essentially means I'm a joint replacement surgeon. I've been doing joint replacements since the year 2002. So this comes to year 23 of doing joint replacements, essentially hip and knee replacements. Prior to Sunway Medical Centre, I was a professor at the National University of Malaysia. Now I'm also a professor with Sunway University. So apart from my work of being an orthopedic surgeon and operating, I also share my experiences and knowledge with local and international doctors regarding joint replacement. And robotic joint replacement is very close to my heart because I was one of the pioneers in Malaysia who started the ball rolling for joint replacements using robotics.
Doctor, let's start with understanding what is knee replacement surgery and the suitable candidates for knee replacement.
Many a times when people speak about joint replacements or knee replacements, they always speak about very loosely about kneecap replacement. So basically, what we do in this joint replacement surgery is when someone, if you look at this model, this is a model of a knee joint, which is arthritic. That's the thigh bone, and this is the lower leg bone, which is called the tibia. And this blue thing here we have is the cartilage, which covers the entire part. So when that cartilage gets degenerated and when the patients are in a lot of pain, what we offer is a joint. Among the things that we can offer is a joint replacement surgery. So when we are talking about a joint replacement surgery, on my right hand side, we have a model which shows what a joint replacement looks like. So essentially, we remove all that cartilage which is damaged and we replace it with the metal on the top, and there's a metal on the bottom, and the center is a plastic. So this top and bottom is made of a combination of titanium and cobalt chromium. The centerpiece is a highly cross-linked polyethylene with vitamin E. So this setup will give the patient a lifetime of anywhere between 25 to 30 years, especially if they use it with the robotics.
Okay, so can you tell us about the robotic knee replacement? How is it different from the traditional method of knee replacement?
Now, if you refer back to this model, and we can see this is how the metal is placed onto the bone. So essentially, when we want to do the surgery, we have to shape this bone in order to be able to adapt this metal inside. Prior to this, when I first started doing knee replacements, we used a conventional method where we introduce bone metal pieces into the thigh bone and then to get the alignments correct. But today we could do all of that using robotic surgery where we put a few pins on the bone and those pins act as a tracker for the computer to receive the information about the bone. And then we map out the entire bone, and all of this is picked up by the computer, digested, and using artificial intelligence and data science, it will calibrate the size for this bone. It will also calibrate how much bone needs to be cut, at what angles it needs to be cut, in order to give us a precise alignment. So when that's done, I bring in the robot and put the robot arm onto the bones, and then I use the saw to cut. Once I've cut, I've got the alignment, and then I can start putting the implants inside. Now, most patients misunderstand when we say robotic surgery. Joint replacement surgery is not totally robotic; it is robotic assisted. This is as compared is it's different from the robotic surgery that people do for gynae, for what you call prostate, for abdominal surgery, where the probes are put in and the robot can help do the surgery, and the surgeon is in a different room doing the stuff. Here, I have to be there to guide the robot to do it. So basically, the robot can't do the surgery by itself. So that's why it's called robotic assisted. And with this robotic assisted surgery, since we have started this in 2019, we have found that patients tend to do much better. And similar to what you have alluded earlier, the recovery is faster, the pain is lesser, the patient's ability to get discharged from hospital is shorter, and they can go back to their lifestyle sooner.
Okay, so thank you for outlining the benefits in terms of patient recovery. Are there any limitations?
When we look at robotic surgery, most of the time there are two subsets to this. One is called imaged, one is called imageless. So when we are doing imaged, we have to send this information into the system, and then the system will calibrate everything, and we come out, all of it will come out together. But often in my practice, I see patients who come in with 45 degrees of angulation, and the knees are very badly bowed or crooked, and some of this may not be able to be accepted by the robotic completely. But since we have been doing this for some time now, we have gotten to know how to educate the robot in order to help us to do this surgery. So as of now, there are no real limitations that in my practice, can't use the robot. So I can use the robot in 100% of the cases, no matter how deformed the knee is.
And what are the do's and don'ts after a knee replacement surgery, a robotic assisted knee replacement surgery?
The limitations in terms of do's and don'ts are quite similar between robotic and non-robotic surgery. Um, Basically, what we want to do is we want to heal the wound. We want to keep this implant in place for the longest period possible. That means we want it to last, if possible, a lifetime. So it's like buying a car and driving the car off road in the jungle and hoping that it will last 15 years. That's not going to happen. So what will happen is, if you do a knee replacement, we usually advise patients not to run, not to jump on it, because you will be doing this and the polyethylene will wear out very soon. So as long as the patients don't do that, they can go back to light sports like swimming, they can go back to cycling, they can go back to golf, they can play very light racket games, but we usually tell them not to do contact sports. Most of my patients even go and do hiking after the surgery. So these are all things that we allow with certain amount of limitation.
And for patients from Indonesia who want to come for a robotic assisted surgery, what should their itinerary look like?
Very interesting, because we used to tell patients to stay around for 1 month before, when I first started doing joint replacements without robotic. And that would take the patient away from home for a very, very long time. So now what we have is, when patients who are coming from Indonesia, they do their preliminary blood test back at home and their urine test to make sure that they're infection free. They send us a copy of their medical report, a simple medical report, so that we know what medicines they're taking, what are their comorbids, what medical issues that they have. They fly in a day prior to the surgery. They get admitted. We do the whole works of blood investigations, ECG, chest x-ray, urine test. Once everything is set, the following day they can do the surgery. So they stay, that's one night. Now the day after the surgery, the following day, the second day, they can start walking already, and they can start using a frame. Often patients think that after a knee replacement, they have to hop and unable to put weight on the leg. But what we have now is after the surgery, the following day, they can put both their feet down, equal amount of weight, and they can start walking. And they are usually in the hospital for another 2 or 3 nights. And after that, I usually encourage them to stay around somewhere in Kuala Lumpur. And at the moment, we have the facility of the Sunway Sanctuary, where most of our patients go over there to stay at Sunway Sanctuary. And then 4 or 5 days after they have stayed in Sanctuary, they'll come back and see me. And if everything is good, they can take a flight back to Indonesia. So we are looking at roughly around 7 to 10 days stay in within around the vicinity of Sunway Medical Centre in total. From the day they arrive till they go back, about 10 days. Now, all my patients are given blood thinners or anticoagulants. So they will need to have that on board until they go back home, which is up to about 14 days. And they're also given special stockings to wear to prevent blood clots from happening. So usually that's the main issue with patients wanting to fly back prior to 2 weeks. And so far, we have not had any major issues with that.
Okay, so I'm assuming when they come back, they have to continue with their post op rehab protocol.
Yeah, so when we talk about rehabilitation protocol, the day after the patient is operated, the physiotherapist will work with them in the ward and to get them to get up, walk, move around, sit, stand, do bending exercises. Now, most patients don't have an issue with standing, walking. It used to be patients used to use the walker for about 6 to 8 weeks. Now, with robotic surgery, patients go off the walker at 2 weeks because they find themselves so stable. Often they complain that they have forgotten their aid and they're walking already. So that's very interesting, and we find that really very very reassuring, and the confidence that we get from doing a robotic joint replacement. Now, whilst they are here, they undergo physiotherapy alternate days, and then when they go back to Indonesia, we will give them a summary and a letter so that they take it back to their physiotherapist. They probably need maybe anywhere between 1 to 2 times per week for the next 4 weeks until they reach about 6 weeks. And some of them, bearing in mind that some of them reach their goals earlier, some may reach their goals later, but somewhere around 6 weeks. So we are looking at 1 to 2 times physiotherapy per week until they reach their goal.
And do they need to come back to Malaysia to visit you for a checkup after that?
After once they go back, I always give them an appointment to come back and see me anywhere within 6 to 8 weeks. Understandably, most of them have got other commitments, and most of them will travel with their kids or grandchildren to bring them over. So everybody has their own affairs. So, but we give them an appointment anywhere within 6 to 8 weeks after the surgery to come back and see us.
Is there any other information you'd like to share with our viewers, Doctor?
I must say that having done joint replacements for the past 23 years, I think we have reached at probably one of the best points in life where we can confidently do a joint replacement that will take a patient through one, good stability, good implant positioning. The implants have gotten better now, and they last longer. So if you were to ask me whether if I had a joint replacement 10 years ago and today, I would definitely prefer to have my joint replacements done today, and definitely with robotics. And it's a testimony that we see in all our patients that they're so happy with the joint replacements, and things have gotten so much better as compared to many many years ago, where people fret to do a joint replacement because of pain, because of poor function, because of poor outcomes, because of a lot of the complications. And I think this is probably the best time. And so I think if someone has an issue with their joints, they should go and see their doctors. And if it is time to do surgery, come see us. Allow us to evaluate you and give you a proper opinion and allow you to have your surgery if you are a good candidate for surgery. Occasionally, we have had to turn patients down, especially if the patient's risk for surgery is far greater than the benefits that they're going to get, especially if they have had multiple comorbid problems. But otherwise, most patients do very well. And it's a very gratifying surgery.
Well, this is great information, Doctor. Thank you so much for your time and help. For our viewers, if you're interested in speaking with Prof. Dr. Suresh, you can have a look at his contact details in the description below. If you are planning to get your surgery in Malaysia and live in Jakarta, you can start your physiotherapy in Malaysia and continue your rehabilitation program in Physioactive Indonesia. On behalf of our entire team at Physioactive Indonesia, we want to thank you for tuning in, and we look forward to bringing you more top quality content from leading industry surgeons. Thank you.
Thank you, Michelle.